Hello everyone and welcome back. So we are going to discuss the C-section procedure and all the important things that are related to the C-section, that is the indications of the C-sections and the advantages and disadvantages, and what are the types of incisions and what is the proper method of the C-section and what are the complications of C-section. We are going to discuss all these things in this video. So for C-section, the common questions that are repeated in the exams are written here, that is G at P7 38 weeks pregnant, previous two C-sections, brought to labor room. So what are the important examinations that are done on the patient of C-section and what are the management options, the investigations and how you will prepare the patient for the surgery, what are the complications, what is elective C-section and what are its advantages, the indications of C-section and post-op complications. The G4P3 presents at 37 weeks gestation with history of previous two C-sections. So what is the mode of delivery, the time of delivery and enumerate complications. So let's start. First of all, what is C-section? It is the delivery of a viable fetus through abdominal route by giving incision in abdomen and uterus for the delivery of fetus and placenta. Now, there are types of C-section which are planned C-sections, that is elective C-section and emergency C-section. The elective C-sections are done in diabetes mellitus and multiple pregnancy and previous C-sections, while the emergency C-section are done in antepartum hemorrhage, placenta previa, placental abruption and eclampsia. Now there are different types of incisions. These are classical or vertical upper segment incisions which are 1% and fenestrial or suprapubic or lower segment incisions which are 99%. This is the classical or vertical upper segment incision and this is done in 1% cases. This is the fenestrial incision and this is done in 99% cases. Now the indications for the lower segment incision, these are absolute indications and relative indications. The absolute indications are major degree placenta previa and contracted pelvis and previous two C-sections, while the relative indications are obstructed labor, malposition or malpresentation, fetal distress, multiple pregnancy, previous one C-section, medical emergency, hypertension and macrosomia. Now the indications for classical incisions are badly adherent bladder with lower uterine segment, increased vascularity in placenta previa, preterm labor with transverse lie, fibroid and cervical carcinoma. These are the indications for classical incisions. Now the advantages or disadvantages of various incisions. For suprapubic or fenestrial incision, the advantages are cosmetically it is good, it has good healing, less adhesion formation, less bleeding, wound strong and less chances of incisional hernia. The disadvantages are that it is time consuming comparatively, inferior visualization of the abdominal cavity, it is difficult to extend and bladder can be injured, hemorrhage due to uterine artery wound. Now the classical or vertical incisions are, and these advantages and the disadvantages are, for classical or vertical incision, the advantages are superior visualization of the abdominal cavity, less time consuming, easy to extend, rapid delivery and less chances of bladder injury. The disadvantages are more bleeding, poor healing. During next pregnancy, it can cause dehiscence. These are the disadvantages of the vertical incisions. Now, the procedure of the C-section. First of all, the preparation of the patient for the C-section is done, that is informed consent is taken, then the indications, outcome and complications etc. are discussed. Then admit the patient one day before the surgery and the patient is nailed by mouth for 6 to 8 hours. Then ask her to take bath and night sedation is done. Antibiotics before giving incision is given. Now, also cleaning of the parts with pyodine before incision and arrange 1 unit of blood. Now the proper method or procedure is that give incision, that is transverse suprapubic incision which is 2 cm above the symphysis pubis, then cut fascia, rectus sheet, then muscles, stretch them to open peritoneum, open umbilicus up to the opaque white area where the bladder is, identify the lower segment where the loose peritoneum is attached, give incision in the uterus up to 10 cm, remove the baby weight and then remove the placenta, secure both angles of the uterine incisions and stitch it, then inverting stitches, look for the ovaries, count the number of swabs so that none are left inside, stitch peritoneum, muscle, rectus sheath, fascia and skin. Now the complications of the C-sections are regarding the general anesthesia, which are cardiac arrest, respiratory arrest, C-section, page number 109. Okay. So here we were discussing the complications. So, first of all, intraoperative complication. Okay, regarding general anesthesia are cardiac arrest, respiratory arrest, choking difficulties, intubation, and pneumonia. Regarding the spinal anesthesia, the complications are spinal injury, spinal shock, and cardiac arrest. Now, intraoperative complications are hemorrhage, injury, and bowel injury, bladder injury, and the post-operative complications are second-degree hemorrhage, PPH, endometritis, incisional hernia, UTI, wound infection, paralytic ileus, vomiting, abdominal distension, and DVT on third or fourth day. The late complications of C-section are fistula, etc. Limit of the C-section depend upon the anatomy of the uterus. 5 or 6 C-sections can be performed if less additions, otherwise 3 C-sections. The post-op care should be done, that is intravenous antibiotics for first 24 hours. Then give baby vitamin K injection. Stitches removed on 5th post-op day. Routine observation is done, that is pulse, BP, and temperature. Pain relief, for pain relief NSAIDs are given. Oral feed, oral drinks can be started, and after 24 hours solid or semi-solid feed is given. Urinary catheter is removed to the next morning, that is 12 to 24%, and thromboprophylaxis is done if patient is in risk, then heparin is given. In next pregnancy, contraception should be discussed, the mode of delivery in the next pregnancy, indications of the C-sections, complications of the pregnancy, and final decision should be taken at 36 weeks of the next pregnancy. Okay, so we have discussed the C-section and all the important things about it. That is, first of all, we have discussed the scenario, that how it is asked in the exams. Then we have discussed that what is C-section. So it is a delivery of viable fetus through abdominal route by giving incision in abdomen and uterus for the delivery of the fetus. Then we discuss the types of C-sections, which are elective C-section and emergency C-sections. Elective C-sections are done in diabetes mellitus patients, multiple pregnancy, and previous C-sections, while the emergency C-sections are done in antepartum hemorrhage, placenta previa, placental abruption, and eclampsia. Now we are having two different types of incisions, which are classical or vertical upper segment incision and fenestrial or suprapubic lower segment incision. So the best one is fenestrial or suprapubic or lower segment incision, so it is 99%, and the vertical incision is done in only 1% of patients. Now, the indications for the lower segment incisions are absolute and relative. The absolute are major degree placenta previa, contracted pelvis, and previous two C-sections, while the relative are obstructed labor, malposition or malpresentation, fetal distress, multiple pregnancy, and medical emergency. Now, the indications for classical incisions are badly adherent bladder with lower uterine segment, increased vascularity in placenta previa, preterm labor, and transverse life, fibroid, and cervical carcinoma. Then we have discussed the advantages and disadvantages of both the suprapubic fenestrial incision, which these are the advantages and disadvantages. Then we discussed the advantages and disadvantages for the classical or vertical incisions. Then we have discussed the general procedure for the C-section, in which first of all the patient is prepped. These are the points that should be performed during the preparation of a patient for C-section. Then this is the proper method or the procedure. And then we have discussed the complications of the C-section, which are regarding the general anesthesia, regarding the spinal anesthesia, and intraoperative complications, post-op complications, and late complications, and post-op care. Then we have discussed for next pregnancy, the contraception should be discussed, mode of delivery in the next pregnancy, indications of C-section, complications of pregnancy, and final decision should be taken at 36 weeks of the next pregnancy. In the next section of the video, we will discuss the anemia in pregnancy, and then we will discuss the hypertensive disorders of pregnancy. Thanks for watching.